Welcome to the Peer Data Standardization training. Before we do a deep dive into the different types of data that you need to collect, we will cover a few introductory topics. The goal of this training, why data collection is important, the barriers you might face and how to overcome them, the peer story and their impact, and collecting data in accordance with your organization's best practices. The goal of this training is simple: to help peer advocates collect a standardized set of data so the Finger Lakes region can better fund peer programming. This can be broken down into sub-goals. Establish a set of data that will show how peer advocates improve health outcomes, train peers on how to best collect that data, and why it is important. Use that data to apply for additional funding, and tell the peer story with data to reinforce their felt impact on the community. You might be asking yourself, why is data collection important? A fair question. One reason is that having a strong grant application to fund peer programming relies on clean, standardized data. Imagine a situation where various ice cream shops in a city are trying to prove that they are the best in order to win a city grant for small businesses. Each shop is asked to provide data to show their popularity and impact. Here's how their data collection goes. Shop A reports the number of customers served each day. Shop B tracks the total sales revenue. Shop C counts the number of ice cream cones sold. Shop D records customer satisfaction ratings on a scale of 1 to 10. Shop E measures the weight of ice cream sold each week. When the city officials review the data to decide which shop should receive the grant, they face a problem. Each shop has provided different types of data, making it impossible to compare their popularity and impact directly. For example, Shop A serves 200 customers a day. Shop B earns $2,000 a week. Shop C sells 500 cones a month. Shop D has an average satisfaction rating of 8.5. And Shop E sells 50 pounds of ice cream weekly. Without standardized data, the officials cannot determine which shop is truly the most popular or impactful. Since there is no way to evaluate who won, the city decides to save their money for a neighboring burger competition, judged by a panel of chefs who have a specific set of agreed-upon criteria which make a burger tasty. We have seen with the food competitions that failing to unify around one simple metric might hurt everyone. None of the ice cream shops got any money, and they lost the favor of the city in the process by being disorganized. That said, it isn't always easy to decide which data to measure and collect. Likewise, sometimes the collection of the data itself isn't always comfortable. This training will help you overcome the following barriers by giving suggestions and context on the data you are being asked to collect. The barriers you might face are asking uncomfortable questions, lack of understanding of the questions you are asking, or lack of understanding from the perspective of the individual being asked, not wanting to ask questions that seem silly or pointless, not having an opportunity to ask organically, not having an appropriate means of recording the answer. The peer story that you know better than anyone else is, peer advocates improve health outcomes. Say it again and say it loud. Peer advocates improve health outcomes, and this is how they do it. Peers improve engagement with individuals' recovery. Peers improve quality of life. Take a moment to respond to the following question. Don't worry, there are no wrong answers for this question, and you will not be graded for this course. Besides peers improving health outcomes, please share your story with us. What does the peer story mean to you? Pause the video here to respond on a piece of paper or in a document on your computer. While it is important, even essential, to collect standardized data, please continue following your organization's specific best practices. Collect and store data how you have been instructed through your own organization's training. Demographic data. Demographics are statistics that describe populations and their characteristics. This section will teach you which demographic data to collect and why it can be impactful for showing the success of peers. The following demographic data should be collected: name, age, address with zip code, contact information, veteran status, gender identity, race, and ethnicity. While most of the demographics you will collect are fairly straightforward, let's briefly touch on some that may be slightly uncomfortable to ask, or perhaps some that need further clarification. As a general tip, Asking a lot of questions early on can be overwhelming. Introduce yourself first with some of the info you intend to ask of the individual. In this case, that might look like giving your name, professional role, and your preferred pronouns. Gender identity is defined by the Human Rights Campaign as one's innermost concept of self as male, female, a blend of both or neither, how individuals perceive themselves and what they call themselves. One's gender identity can be the same or different from their sex assigned at birth. Asking about gender identity can feel delicate. However, it can be important to ensure you are not misgendering someone, meaning referring to a person as a gender that doesn't align with their identity. You can ask this question in a few ways. How would you describe your gender? What is your gender identity? How would you describe your current gender identity? You can also follow up by asking, what are your preferred pronouns? You probably already have an implicit idea of what is meant by race or by ethnicity. Let's take a quick look at a more in-depth definition of each. Race is a socially defined concept that groups people based on physical characteristics, ancestry, language, or other factors. Race is often associated with biology and inherited as an identity. Ethnicity is a social categorization based on an individual's identification with a cultural or ethnic group. Ethnicity is linked with cultural expression and learned over time. It focuses on cultural characteristics like language, history, religion, and customs that are often passed down through generations. How does collecting demographic data help? Select from the following options all of the ways you believe collecting demographics can be helpful. Pause the video here to record your response. The correct answers are interaction data. Interactions come in many shapes and sizes. Tracking each interaction can showcase the depth of support given to an individual in need. This could be a one-on-one meeting, group session, outing, event, or the transport of an individual. The following interaction data should be collected: time, date, and duration, method of contact, location, stage of change, transportation data, including date and time, duration of time, driving and mileage, to and from location. Please record the method of contact for each interaction. A few examples are phone call, text, email, telehealth, Zoom, or video call, in person, mail, walk-in, or any other means by which you have reached someone. The stages of change, a model developed by Prochaska and DiClemente in 1982, is commonly used as a basis for developing effective behavior interventions. Whereas most may see the need to change a behavior as an event, quit smoking, drinking, etc., this model shows that change is a process that goes through 5 stages. Change is often accompanied by supports and challenges, and by looking at the dynamics of the stages of change, we will better understand the process. The 5 stages of change are pre-contemplation. Person shows no intent to change a problem behavior. Person may be unaware behavior is a problem or unwilling to do anything about it. Person may lack confidence to change behavior due to previous failed attempts. Person tends to view target behavior as being more positive than negative. Decisional balance. Person believes the behavior to be under control or at least manageable. Contemplation. Person is considering change, but has not yet initiated any change behavior. Person is considering implications and consequences of behavior. Person is visibly distressed by target behavior. Person has started to weigh the positive and negatives of the target behavior. Person will typically seek out relevant information about the target behavior. Preparation. Person is getting ready to change the behavior, both in attitude and behavior. Person intends to change soon. Person may have already started to increase self-regulation around specific behavior. Person may be prepared to make, or may already be making small changes to the target behavior. Action. Person is actively making change to target behavior. Person is modifying his/her attitudes and responses to target behavior. Person is learning skills to prevent relapse or reversal of target behavior. Action stage typically lasts an average of 6 months in people working to change substance use. Maintenance. Person sustains and strengthens changes made to the target behavior. Person is practicing skills to prevent relapse or reversal of target behavior. Person establishes basic habits and rituals around modified behavior. Transportation data is fairly simple. If you have provided transportation services, the following data should be collected: date and time, duration of time driving, and mileage to and from location. Generally, interactions are straightforward. There is, however, one type of data that you might have additional questions about collecting. A barrier for collecting stage of change data might be that any individual could face several different life events and challenges at a time. For each of those life events, they could be in a different stage of change. For example, someone might have substance use disorder, be experiencing homelessness, and be experiencing food insecurity. While this person might be in contemplation for their experience of homelessness and action for their food insecurity, they might still be in pre-contemplation for their substance use disorder. The way to handle this is to record the stage of change that an individual is in for each life circumstance or event that they are facing. This could include life events that you have observed or life events that the individual is seeking resources for. How does collecting interactions data help? Select from the following options all of the ways you believe collecting interactions data can be helpful. Pause the video here to record your response. The correct answers are outcome data. Outcomes are the result of an action. In this case, we are looking at health and health-related social outcomes correlated to peer interventions. The following outcome data should be collected: date of last ER visit, date of last hospital stay, employed full-time or part-time, last use date, Narcan training status, satisfaction data. Has the individual received Narcan training as a result of or during your interaction? This is a simple yes or no answer. Outcomes data is generally straightforward, but can sometimes be delicate to ask about. A tactful approach is essential to maintaining the bonds you have formed with the individuals you serve. Start with a conversation. Don't jump straight to the question. Talk about their overall well-being, current challenges, and goals. This helps establish a trusting relationship. Express empathy. Let them know you understand that substance use can be complex and that you're there to support them without judgment. Use I statements. Instead of saying, "When was your last use?" try, "I'm wondering if you could share with me when you last used substances." This makes the question sound less accusatory and more collaborative. What is true about outcomes data? Select from the following options all of the ways you believe collecting outcomes data can be helpful. Pause for a moment to write down your answer. The correct answers are referral data. Referrals are when you direct an individual to treatment or services that could be useful in their recovery. When attempting to refer someone to services, it is important to get all relevant information about their current life situation so that you can connect them with what would be most helpful. Here are some areas of inquiry that you ought to pursue: housing and utilities, food security, transportation, employment, education, and interpersonal safety. Beyond the broad categories and the specific associated questions, collecting the following is essential for highlighting peer impact. Referral type, role of person making referral, peer, care manager, etc. Referral date, status, or outcome of the referral. The main barrier to collecting referral data is finding the time and space within a conversation to run through this tool with an individual. It might take a bit of relationship building before you ask for an individual's help filling out these referral questions. Start with a conversation. As with many of the other barriers you face as a peer advocate, trust starts with an honest conversation. Express empathy. If you already have a hunch that the individual you are speaking with would benefit from a referral for additional services, you could offer up an example of a time such a referral helped you personally. Failing that, you could relay another success story. Ask if now is a good time. Even if someone is initially receptive to helping you fill out a referral form, and indeed receptive to being referred for additional services, it is still good to ask if they have time to fill out the form with you. Give them an estimate of how long it will take. You might be thinking, how do I know the outcome of a referral? In the event that the service or organization you referred an individual to does not inform you whether the individual has used their service, you can simply record referred. If you do receive an updated outcome from the service or organization in question, record that outcome. For example, If the individual made use of a housing service, you might record that as utilized. Outreach data. Outreach data refers to information about efforts made to connect with individuals in the community. The following outreach data should be collected. For event outreach, collect date and location of event, including zip, number of individuals outreached, number of resources and/or materials provided. For individual outreach, collect method of outreach and date and time of outreach. This refers to the way you connected with an individual. For example, over the phone, at a shelter or service location, walk-in, email, job fair, etc. This is similar to method of contact, but specific to outreach style interactions. Collecting outreach data is generally straightforward. The barriers here are finding good methods of tracking and recording numbers, and having consistent methods of outreach. Event outreach. There are two main numerical sets of data that you ought to collect at events: number of individuals outreached, number of resources or materials provided. There are a few strategies you might employ to collect this data. Print a specific number of resources. When you leave the event, count the remaining resources. The difference between the two will indicate number of resources provided. Tally each time you talk to someone about the services your organization provides. This could be on paper or wherever your organization prefers. Whether you are doing event outreach or individual outreach, collecting the method is critical to understanding successful outreach strategies. Here is an example of a barrier. Several peer advocates work at an organization. Each records titles for a method of a similar type in slightly different ways. One peer puts SMS. Another puts text. A third says message. This can lead to unclear data. Overcoming this barrier. For methods, use predetermined words for each category. If your organization is recording this digitally, a drop-down field is the best way to solve for these potential conflations. However your organization intends to record this data, make sure the categories are set in advance. Qualitative data. Qualitative is defined by Oxford Language as relating to, measuring, or measured by the quality of something rather than its quantity. This can mean a few different things in context of peer advocacy. There are three common types of qualitative data that can highlight the peer story. Success stories. As a peer, nothing compares to watching an individual succeed in their goals. Being able to share their story not only feels joyous, it contributes to the overall narrative that peers improve health outcomes. Interviews. Perhaps a peer or someone seeking services has a particularly strong voice. Sharing their experience can give a behind-the-curtains look at the important place peers have in recovery. Testimonials. Sometimes an individual has such a fantastic experience working with a peer, they want to share support of their personal peer advocate, or even the organization at large. Sharing this with the community can serve to amplify the peer story. Collecting this data can be valuable for news stories, press releases, web copy, and social media posts. How often does your organization post content of this type? Work with leadership to determine a cadence for collecting qualitative data. It is important when sharing success stories to not share any PHI without written consent from the individual whose story you are sharing. Read through some examples of PHI below. Qualitative data is rewarding to collect and as a result fairly easy in most cases. Using this data, however, can come with some risks. While not exactly a barrier, using qualitative data requires asking for permission. If you are interviewing an individual who has received services from your organization, or if you are getting a quote for a testimonial, it is critical that you receive written consent to use their words and/or name in any publication. Likewise, if you are telling someone's success story, ask permission first. If someone is reluctant, you can offer to omit or change their name to protect their identity. If they are still hesitant, that is okay. You should respect their boundaries. There is an abundance of qualitative data. Only use data of this type from people who are willing to share. Please share with us a time that you feel you have succeeded as a peer. This could mean many different things, but as long as you feel it highlights the great work that peers do, we would love to hear it. Pause for a moment to write down your answer. Let's review. There are a number of reasons to collect data. It showcases the peer story, it can help advocate for better funded peer programs, and it helps to identify community gaps. Let's review the peer story one more time. Peer advocates improve health outcomes, and this is how they do it. Peers improve engagement with individuals' recovery, and peers improve quality of life. Many requests for proposals, or RFPs, will ask applicants to supply proof that the work they do yields results. While you have seen firsthand and indeed participated in the great work that peers do, simply telling funders about that work isn't enough. Yes, qualitative data such as testimonials can certainly help, but showing evidence of the impact peers have every day is critical. Data and the ability to tell a story with it is what secures funding. Another positive result of collecting the discussed data is that it will help to identify service gaps at a local, state, and national level. This will lead to more accurate resource allocation and to better overall health outcomes. For the last question of this course, write a scenario in which the collected data might tell the peer story using at least two of the data categories we've discussed today. For example, there is a grant opportunity for nonprofits serving rural areas to provide transportation to jobs in the nearest city. Your peer organization has demographic data of zip code from individuals living in these rural areas and interactions data of providing transportation services. When applying for the grant, you can tell the peer story with numbers of transportation services provided to individuals in the stated zip code, all due to the data you've collected. What's more, if you also collected qualitative data in the form of success stories, you can add that to the application if it is requested. Give your own example here. Congratulations! You have completed peer data standardization.